Okay, welcome everyone. United Way's mission, well, let me start back where I should. Katie is the major gifts manager for the United Way of the Capital Region. United Way's mission is to improve lives in our community. Specifically, they work to help low-income families gain independence by providing critical programs in basic needs, school readiness, access to health care, and workforce development. Katie is responsible for securing support for United Way's programs. Previously, she was their grant writer. She is no stranger to Derry Presbyterian, and that's why I'm introducing her. Previously, Katie worked for the Susquehanna Chorale and has attended many concerts at our church here in Derry. Welcome, Katie.
Thank you. Thanks so much for having me today. You can all hear me okay?
Yep.
So yes, thank you for that introduction. I am no stranger to this church. It's a beautiful church. Is that really the golf course? Like, right
Yeah.
I heard it sounded like the club connecting with the golf balls. I never realized how close we were because we were always here in the evening. So, wow, beautiful morning to be out there. But yes, thank you so much for having me today. Let's see. So, Greg described our mission briefly, and I'm going to guess most of you are familiar with United Way to some extent. You've heard of us, you know basically what we do, but I'd like to tell you a little bit more this morning. I think you might be surprised at how much our United Way has grown and changed and adapted in the past decade, really, you know, in terms of how we carry out our programming and what we're doing in the community and then the true impact of that. I don't want to focus too much on the history, but I will just say briefly, we are just over a century old. Our local United Way was founded in 1921. Our United Way of the Capital Region covers Cumberland, Dauphin, and Perry counties, so tri-county area. It started as a common fund. Again, this was a century ago when you know, a lot of agencies were doing great work, but they didn't necessarily have the staff to raise money and to have collective efforts to support the work that they were doing. So somebody came up with a concept of what would be a common fund, and the whole community would be invited to support it, and then the fund would be distributed to these different agencies so that they could carry out their mission. And in many ways, that's how United Way functioned for years, really, until, as I said, about the past decade. And we would do that locally. We would have our annual campaign and then distribute the funds to the community, to a number of worthy agencies for their work. United Way is known for being in our community all the time, but really in our greatest times of need throughout some of the biggest events in our history, the Great Depression, World War II, locally, Hurricane Agnes, and then more recently, the COVID-19 pandemic, which it seems to have fallen off everyone's radar. It seems like so long ago, but we're actually still feeling some of the effects of the pandemic, the long-term effects in our community, and we are still actually working to support some of those efforts. But again, I don't want to focus too much on the history. I want to tell you about what's happening now. And I enjoy the opportunity to come to a church, and I think you of all people will appreciate the work that we're doing, because United Way is by no means a religious organization, but a lot of the work that we do aligns so closely with the work that the church is trying to do, human service work, and just making sure people have the resources that they need to thrive, to be healthy, and to have a level of independence so that they can care for themselves and for their families. So basically, as I said, we about a decade ago, we made a major shift in how we carry out our work. And this was done very intentionally and with a lot of research behind it. United Way of the Capital Region initiated a major community assessment. We didn't do this alone. We had several partners from the nonprofit sector, from the business sector, from local governments and chambers of commerce. We really wanted to get everyone at the table and really just to look at what our community's greatest needs are. United Way it's actually a worldwide organization, but each local United Way has some autonomy in the work that they do, simply because the needs in our community look different than the needs even in nearby, Philadelphia or Pittsburgh, which are in our same state, but each community is so unique. So we wanted to make sure that we were doing what's most needed here. And what we found through our research is that these are the 4 pillars or programs that we focus most on. Basic needs, which of course everybody, that's always been our greatest source of requests for support. Basic needs, making sure people have what they need to survive on a day-to-day basis. Education, and specifically preschool readiness, having children, providing a preschool experience so that children are ready when they start kindergarten. Health, being basic access to healthcare, making sure that everybody can at least have a primary health home and get dental care and get classes if they need them, and just have that basic care so that they can function each day. And also income, because if you don't have income, you can't support yourself, of course. So, but we want to make sure that people have the means to find that employment and to sustain that employment. So I'll get into each of those just a little bit more. But before that, I wanted to just follow up on the study that we had done, and I mentioned this was about a decade ago that we did this major community assessment. The other key finding is that the ALICE population, it's assets limited, income constrained, employed. It's an acronym for that. We used to call them the working poor. We don't use that term anymore. But basically, these are people who work sometimes 2 or even 3 jobs, but they're usually minimum wage. They usually can only get part-time hours, so they don't get access to health care to their employer. For whatever reason, these are people who are working and they're trying to make ends meet, but they just can't. And the end of the week comes and they either have to choose between buying food and paying their rent and providing for their children. And we found that this population, they're like the in-between. So there are people who qualify for government programs if they're below the federal poverty threshold. But then there's this population in between. Again, they work, which excludes them from, the income and the fact that they're working excludes them from certain government assistance programs. But yet, as I said, they're still struggling. United Way of Pennsylvania does extensive research on the ALICE population. In fact, they just published their 2024 report. I put some copies on the piano for anybody who's interested and would like to take more information. But basically, reported ALICE households in central Pennsylvania range anywhere from 25 to 29%. But what's really interesting is that it varies by community, even within each county. So, the average being 25 to 29, but you go to a place like inner city Harrisburg, 55% of families qualify as ALICE. Certain other populations within our service area, the needs are much greater. So again, United Way wants to use our resources most wisely and to go where we are most needed. So that's why we focus on that population, simply because we found that their needs are not being met elsewhere. So to go back to each of our 4 pillars, just tell you a little bit more about them. Basic needs, always the greatest request for support. We focus on emergency food and shelter. Rent and utility assistance for a person who might be evicted, somebody who needs emergency housing. And we do that again because this is an area that we found where we are most needed, where we can have the most benefit. There are other programs for people to get long-term housing assistance. It's that in-between to get them to a place where they are in a permanent residence. But I would add that a couple of years ago, we expanded our definition of basic needs. Child care services for working families. We will support families who are, say we get them a job through the workforce development program, but they're paying $1,000 a month in child care, which is like that's like the standard rate to get quality child care. And if you have more than one child, who knows what that could be. But what we found is that, these families, they're working, they're trying to support themselves, but the child care was just draining all of their resources. So we don't provide the child care. We work with a lot of community partners, but we have vetted numerous child care facilities in our Tri-County region, and we will provide support for those families. We don't hand the money out, but we will give them credits. We will pay directly to the child care center so that their children can have child care when they're working. And this is not indefinite. It's while their children are young and need that child care, and I believe we will provide support for up to a year for these families just to help them get on their feet. The other things we've added, language support, which we have a surprisingly diverse community in central Pennsylvania, and we want to be able to communicate with them. That I'll talk more about this, but there are multiple barriers usually, not just one, but multiple. So if you have a person who they can't adequately speak English, so they can't go on the websites and read what they need to do or enroll themselves for help. So we fund services, case management services, which is another one. We have a wealth of resources in this community, but we found that sometimes people just don't know how or where to access them. So by putting people in touch with case management services, providing the language support, it helps us to connect them to where they need to be to get them the help that they need. So, and I won't read through these numbers, but these are just some of the statistics. We are helping a lot of people. We do this, again, in partnership with a number of agencies, and that's another thing that our United Way has found. There are numerous agencies in our community that they're doing great work. The infrastructure is there. We're just providing financial support to them, but we're also taking a more active role than we used to, in that our United Way kind of acts as the backbone organization. We're trying to keep all of these organizations on the same page and moving forward in the same direction so that we can provide services more efficiently as a community. So that's really our role for that. I talked briefly about Ready for School. This is one of my favorites. I love this one. So I think most of you, even if you don't work in education, you've heard the statistics that if children don't get the resources they need as preschoolers and they're not ready when they start kindergarten, not that they can't succeed or that they won't succeed, but it makes it a lot more difficult, because in those early years we're learning more and more about how critical those preschool years are. And yet through our studies we found that there were families that were not sending their children to preschool because they just didn't have the funds to do it. So United Way partners with 11 different school districts throughout central Pennsylvania, and we provide these workshops. They're held weekly and they're held year-round. During the school year we hold them on site at the schools, and then in the summer we'll hold them in parks or libraries, usually somewhere outdoors. But and we hire what we call them education liaisons, because they're doing more than just teaching, but they're teaching children, they're learning the basics, they're learning their numbers, and reading is a critical activity, and they have lessons to prepare them for kindergarten. But we also focus a lot on social and emotional building skills. What we've heard from the school districts, and I mentioned about the pandemic a few minutes ago, but we're hearing that a lot of the children who are coming into kindergarten are still socially and emotionally not quite where they need to be. And we think some of this goes back. These are the children who were born during the pandemic, and they're still suffering the effects of the isolation of that. So we focus a lot on social and emotional skills for the children. We also will send educational kits home for the parents and caregivers so that they can repeat the lessons at home and read to their children and really reinforce what the kids are learning. And it also is a way for the parents to feel more involved. We will connect families with early intervention and support services. So again, our liaisons are qualified professionals. They are good at identifying if a child is struggling with speech, or if they really possibly fall on the autism spectrum and might need some early intervention. And again, I mean, I'm not a professional educator, but I know that the earlier they get to kids, the better. And you know, if there is an issue, the earlier they can get intervention, more chance they have of succeeding. So the other thing we will do is we will connect families to preschools and provide tuition assistance. So our workshops are once a week, but some parents are looking for a little bit more than that, and that's okay. And if they have the ability to transport their children to preschool several days a week, or maybe they're working part-time and they need more of a daily preschool, we'll connect them to that and try to get them enrolled. And so again, evaluation is a critical part of what our United Way does. We want to make sure that we're reaching the right people and that we are being effective and using our resources in the most efficient way possible. So we routinely monitor, these are just a few of the statistics, but I forgot to mention that we also will help families register their children for kindergarten, which I know might sound pretty basic, but again, a lot of school districts have gone to online registration for kindergartners. So if you have a family who doesn't have the technology at home to be able to go online, or maybe they don't have the know-how, our liaisons will work with them and just, you know, provide a device for them to sit with them and get their child registered to make sure that happens on time. So we've helped a lot of students with that. We also monitor, so we connect with the school district and we measure the children in kindergarten up to 3rd grade. This is just for the kindergarten statistics, but what we do is we use our participants, children who have gone through our program, we compare them to what I call their peers. So children from a similar demographic who did not go to preschool, did not go to our program. And we use that as a basis for comparison. So and you can see that our participants are typically much more proficient in reading than some of their peers. So it is working. It is helping. And we do this quarterly. We update the statistics quarterly. They vary a little bit from quarter to quarter, but we have consistently run ahead of their non-participant peers in terms of how they're doing. So Contact to Care, that is our healthcare initiative. And this is where our primary goal is to get people to a primary source of healthcare. We connect individuals to an insurance enrollment specialist if eligible. And that we always want to get them enrolled. There are insurance programs available. I admit insurance just confounds me. I have a person at work in our HR department and they just walk me through it and whatever, but for people who don't have, again, the resources, they may not know where to look or have the technology to be able to enroll themselves. So we have, we employ, they're called community health workers, wonderful people. They're not necessarily health workers themselves, but they are strategically located at like a Hamilton Health Center or Christ Lutheran Church. There's a checkup clinic. In Harrisburg, the Allison Hill section. So we will place our community health workers strategically throughout our service region so that they can be there and just guide people through the process and help people navigate the healthcare system. And again, I'm guessing all of us in the room have had the benefit of health insurance and access to healthcare throughout most, if not all, of our lives. It is a learned behavior, even if we didn't realize we were learning it, just by going to the doctor or going to whatever specialist we needed. So my son is now 20 years old. He went to a 2-year program at Hack and he's now a certified auto mechanic and working full-time and doing all kinds of grown-up stuff. He's doing great. But when he turned 18, with the HIPAA laws, I can no longer make health appointments for him. He now has to do that on his own. So I actually had to walk him through the process. I'm like, how do you not know? You just go, you either call or you go online on your portal and you make an appointment. But look, I forgot. This is second nature to me. So I had to actually walk him through that process. And then I told him about the non-urgent nurse care line. You can call in if you have a question and you just leave a message and they'll get back to you. It's great. I've used it sometimes, but he never knew that was available, and he's like, really? I just call them anytime when I have a question? I can just ask them any questions? And I'm like, okay, maybe not every day, but yes, if you have a health concern, you want to ask them, but you don't need an appointment right away yet. So again, just teaching people, the resources are there, but we want to teach them how to use it so that they're not missing appointments and then getting charged for it. If you have to cancel an appointment or reschedule or whatever, just walking them through that process. We found there's definitely a need for that. So again, we collect information. These programs, I should add, we piloted these the school readiness, access to healthcare, and workforce development. They were piloted in about 2018, so they're still fairly new. But collectively, we have helped almost 900 people obtain insurance, and 2,084 individuals now have a primary medical home. So again, trying to keep them out of the emergency room. We're trying to keep their illness or whatever health issues from becoming something more serious. So control the blood pressure before it becomes heart disease or a stroke or something much, much worse. So that's really, we're trying to keep people healthy. If you don't have your health, it's so hard to go about your day, to do anything productive. So, and we've also, after the program was launched, we added vouchers for dental, vision, and now mental and behavioral health services, which has been huge. We don't distribute money to people, but we will give vouchers for them, and our community health workers help connect these people to sources, whether it's a checkup clinic or there's a dental clinic at Christ Lutheran in Harrisburg, and different sources where they can go if they need these services, which of course everyone does. Mental and behavioral health, I'm sure you've heard the statistics, it's just exploded, especially since the pandemic, and people are just having so much trouble getting the help that they need. But we now have a community health worker who's located at the Pennsylvania Psychiatric Institute in Harrisburg, and that is her sole function, to focus on that part of healthcare and just educating the public about the need for that. So, and then finally, Road to Success. This is our workforce development initiative, which is, I was saying, we help individuals not just to get a job, but to get a job with livable wages, a job with health benefits, a job with an opportunity for advancement, so that they're not just surviving, but truly being able to support themselves. And we also want to help them keep that job. So like my son, again, I love him. He's maturing in so many ways, but he is now working full-time. This is his first full-time job. And he had a dentist appointment coming up. And it was like a week later. It was the first thing in the morning, so he was going to need to be late for work. I said, did you tell your supervisor? No. You need to tell him. I know that sounds basic for everybody in the room, but for somebody who has never worked a full-time job before or had a professional position, and again, and I could go off on I won't go down that road too much, but just speaking to the cycle of poverty, we're really trying to break through that cycle. If the only thing that a person has known, if the only behavior that's been modeled to them is somebody who doesn't have a job, they may not know all of these intricacies about having to call if you're going to be late, or if there's a transportation issue. That's huge for a lot of people. That's a regional issue, but we are trying to help people. The transportation will provide bus passes if they have access to the busing services, or we have a program where we will help them purchase a used car. We give them down payment. We have a partnership with Members First Credit Union, and they've been very generous in helping people to get a small loan if it's a decent pre-owned car, so that they can get to their work. We also, as I mentioned, the child care assistance, we now consider that a basic need, and we will help people so that they can keep their job. We hear that's what, the child care is a huge issue for people who, if you survey employers, that's a reason why a lot of people have to call in sick, because a child is sick or they have problems with their child care services for that day. So again, just trying to work through multiple barriers to help people succeed. So you'll see here we have 222 graduates, what we call them graduates. People, they could be in this program for anywhere from 18 months to 2 years, because we have found that, it just depends where they are in their journey, and we will meet them where they are. So we've had people come to us who didn't even finish high school. So the first step, help them get their GED. And then from there, if they want to take advantage of perhaps a vocational training, not a four-year college, but there are some programs at HACK, Certified Nursing Assistant. That's a huge need right now, and that's great because people who have their CNA, it's a pathway for them that if they do well with that, they can hopefully go back and become an LPN or a registered nurse or whatever. So we're trying to help open the pathway for people, not just get them in the door for a job, but to help them really succeed long-term. But I'm really excited about, again, we monitor this routinely, but the retention rate for our Road to Success employees versus, so 79% versus 64%. We found that by the support that we provide for them is really helping them to succeed in a big way in their jobs. So let me see here. The only other program I would talk about, and this isn't considered one of our 4 pillars, but it goes under the income area that we try to help families with. So this is money in your pocket. We help people from low-income families or individuals. There's an income threshold, but they can come to our tax clinics for free tax prep services all during tax season. It runs from roughly late January until tax day in April. This is it's something that most people don't think about, but everybody has to file their taxes by law, but yet our population that we're working with, they're less likely to be able to afford a professional service or even the tax software, or they might not have the technology to be able to do it. So we have, it's all volunteer driven except for one staff person who oversees the whole effort. But we have volunteers who go to these clinics. They're held once a week in all different, throughout Cumberland, Dauphin, Perry County. And in 2024, we were able to help get a collective $4 million back to families. I think the average return was something like $3,000. And so for a family that's trying to live off of $25,000 a year, that maybe $5,000 or $6,000 could be a huge difference for them. So this is a wonderful program. I always like to tell people about it. We're looking for volunteers now. If anybody is interested, you don't have to be a CPA by trade. We do provide training, and a lot of it is, in fact, all of it's done through tax software. So if you know how to operate the software, you're good. So, oops. So anyway, I just, again, I know I talked about this a little bit earlier, but basically our goal as a United Way is to remove any barriers to a person's success, to a person's ability or a family's ability to care for themselves. And we found rarely is there one barrier, which is why, and I think this is the greatest strength of our United Way, that because we have the 4 different pillars, and because we're like the backbone organization for multiple human service agencies, we are well equipped to refer people for services. So if we meet someone in our Ready for School initiative, a family that's struggling to put food on their table, we can refer them to one of our agencies that provides food or shelter if that is needed. Somebody who needs health care comes to our Contact to Care program, and we find that they have young children. Hey, let's connect them to our Ready for School initiative and get them involved in that. So there's just so much opportunity there. And we really are well positioned to do that, to really make sure that people are getting all of their needs met. So it's a very integrated approach between all of the programs. And so there was a video that a link to a video. Is that going to be a challenge?
I think it's on the desktop.
I'm almost afraid to ask. If you can't find it, it's okay. It's a 3-minute video about one of our.
You can minus that down. I think it's on the desktop.
Okay. Resend. How do I do that?
Katie, in the interim,
Yeah.
I'd just say that I'm affiliated with Country Meadows, and I think the last count, we had employed 15 people who had
Wow.
graduated from Road to Success, and some of them are still with us, and it's been a great program for them as well as for us. So.
Wonderful. Thank you
Yeah.
so much for sharing that.
Yeah.
I wondered, I didn't want to speak on your behalf, but I know that you are one of our employer partners with that. And so, what has your experience been like with these workers when do you feel like they're supported and like they're?
Well, absolutely, and our field is one of unfortunately a lot of turnover, and so the retention statistics that you quote there are essential to keeping people, because experience does matter, and so many of the things that cause people to have to leave temporarily or permanently have to do with the things that the program, your different programs cover, and transportation and healthcare and childcare are among, always among the highest reasons why people have to leave.
Well, thank you so much. We appreciate your being willing to work with our participants. And that's a good point too. Our participants are, as I mentioned, they're at any place in the spectrum as far as, some not having a high school degree. So
Yeah.
we've had people come to us who they've worked in a profession for maybe 20, 25 years, but all of a sudden that profession is no longer needed.
Yes.
So, they've had to shift gears, but they're not quite retirement age, so they shift gears, and we can help them to figure out what it is, what their skill set is. We, help them get a resume together. We'll help with attire for them to attend an interview. Really the whole process, the whole stage.
The other thing is that in senior living, whether it's skilled care or assisted living, someone must be a high school graduate or be a certified nursing assistant. And if someone graduated from high school outside the country and they can't get a copy of their high school diploma or the high school a printout of their grades for review by the Department of Human Services to confirm that the coursework was consistent with our standards here in this country, they cannot work in this field unless they take training and become a certified nursing assistant, or get a GED. But that's easier said than done for people, getting a GED for people who are still learning the language and what have you. So that CNA program that you work with through is essential to getting a job for some of these people, and who just so much appreciate being able to work in this country.
Appreciate that. Yeah, and, I'm sorry, go ahead.
Katie, I'm a small business owner. I
Mhm.
own a family art studio. And you talk about barriers. I had a family, a mother and a child, come into my studio. It was one of my busiest days. And so it took me a couple days to figure out what was going on. But this family was in crisis and they needed help. So I started to reach, I believe that they were on the run, and I believe it was probably domestic violence. They needed intervention and they needed help. I have a friend who works over at Milton Hershey, and she's given me some pamphlets, but I quickly recognized too, whether it's a computer or a pamphlet, they needed somebody to talk to. Is there a
Yes.
number?
You
Or-
can always call, so, are you familiar with 211?
Yes.
That's probably the best place to start because they are, that's what they, it's, for those of you who aren't familiar, so 911 is for emergencies, like a fire or a car accident or whatever. But Pennsylvania has, it's 211, you literally just dial 211, and then you're connected to a source, like a bank of people who have, they can refer them to any number of
Okay.
resources, depending on what they need. But yeah, and they feel.
I don't think it was by accident that they ended up at my studio.
Yeah.
Yes. So they were looking for help, but I was not. And I've heard of 211, but I've never utilized that. So somebody on the other end, we explained the situation, they would connect us.
Yes,
Okay. And I think she needed somebody to help her with that.
yes. Yes, and you know, that's such a good point. Something that we do, if you can't find it, it's okay. I can just- It's okay. So we make a series of short videos of people who have been helped. I'll just tell you the story of it. But there's a woman named Kim, and she came to our Road to Success program, workforce development. A couple of years ago, she was actually living on the streets. She was homeless, pregnant. And however she came to be there, I don't know, whatever. We don't really ask questions. We just meet them where they are and try to get them to a better place. But so Kim connected with one of our case managers at New Hope Ministries and just needed help. Did you see the video? This is, okay. Well, it's on our website, by the way. You can access any of our videos if you're ever interested, and they're all very brief. But Kim was living on the street, and she was connected to one of our case managers, and she, long story short, case manager helped her get work attire, got her transportation, she got a job interview with Giant, and got hired as working in their deli. So good, you know, and they provide benefits, and it was full-time hours and so forth. So she did really well, and they were so happy with her that they recommended her for a management training program. So now she did the training program, and we just connected with her recently, and she, of course, had her child in the meantime. So she is the assistant deli manager for a Giant store, and she has a home, and she has a pre-owned car that gets her to and from work, and she's caring for her young child. In fact, we were excited to hear from her because we're trying to connect her child to our Ready for School initiative and get her involved in one of our workshops there. So it's a really great, one of our success stories, and we do have many success stories. We're always hesitant because, you know, it has to be a person's choice to be able to share it. You know, again, their circumstances are very personal, so we don't want to exploit that in any way. But some of our participants are willing and happy to talk about it. So, and that was actually something else that I feel like I can talk about here because we're at a church. And again, United Way is not a religious organization by any means, but we do partner a lot with churches and with church-based ministries in the community, open to anybody who comes to get help. But so I just wanted to speak to the emotional and support component that our programs provide for people. And I can't quantify it with numbers and statistics, but so for instance, Kim, who I mentioned, who was living on the street, her case manager provided the physical resources, helped her to get a resume together and the work attire and so forth. But she also was giving her a lot of encouragement, like, yeah, you can do this. You're worth it. You deserve a job. You deserve to be able to support yourself and your child. And that case manager, Lisa, is wonderful. She's now retired, but she was really giving Kim the encouragement that she needed and the moral support throughout that whole process. And for somebody who's down on their luck, I mean, again, I don't think anybody ever plans to be living on the street and homeless, but I'm guessing that, you know, things have pushed them down a lot in life, and sometimes they just need someone to help encourage them and lift them back up. I mentioned Christ Lutheran Church, which is in Harrisburg. It's in the Allison Hill section. That congregation, I think the church has been there for about 200 years. Not quite as old as Derry, but it's been there for quite, I understand you just had a 300th anniversary, so congratulations. But Christ Lutheran, their congregation in their earlier days, they had about 2,000 people, and they are now down to about 30 members. But they realized that where they're located, there's such a need in that community, and their building is so accessible that they have opened it up, and they now have an extensive healthcare ministry at their church. They have a dental clinic that is held twice a month. It's on Friday mornings. We have dentists and hygienists who come and volunteer their time, or United Way will sometimes pay a small stipend to them because they do have to close their own professional office for a time to go there and help. But this dental clinic is on Friday mornings, and it's first come, first served, and apparently people are lined up out the door an hour before it opens, just waiting to get help. And I toured the church in the summer. They actually have a room, and there are 2 dental chairs. It's like going to the dentist office. It's set up for this. But they serve people twice a month and try to get as many people in as they can, and just whether it's a cleaning and checkup or a filling or whatever. And then we also, they also have a walk-in clinic I think it's once a week, which is more for general checkups, general health care. They keep food there for people who might need to get a meal while they're in. But the pastor there was telling me a story about a gentleman who came in and he had extremely high blood pressure, to the point where the nurses there actually sent him right to the emergency room, and they got it under control, and he was okay. So he came back to them the next week, and he talked to one of the nurses, and he's like, wow, they sent me home with all these medications, and I'm really confused. I don't know what to do. So she went through it with him, and they made a schedule, and she was identifying the different medications and so forth. So he came in again the next week. Oh,
Will that get you to it?
it should.
Okay.
Yeah, let me see if I can find out.
Cool.
Thank you so much.
All right,
I'll see if I can find the video in a minute. So anyway, this gentleman came back in, and the nurses helped him through that. But then he came back a week later. Same questions. I have these medicines, I don't know what to do, and another nurse helped him. So a week later, he came back a third time, and the nurses were finally like, okay, what's going on here? We've already talked you through this, and he admitted that he was just lonely. He lived by himself. It frightened him, this health scare that he had, and he was just really looking for support, the moral support, the encouragement, the kindness from these lovely nurses who work there, and that's what we find a lot. It's a big part of our program. Yes, we can provide the physical resources and provide the vouchers for service and whatever to get people where they need to be, but there's also that component of providing encouragement for people who have maybe just been down on their luck, had a really hard life, and they just need to be told that yes, they're worth it, and that they can get to a better place. Same thing with our school readiness initiative. The parents who go, I should say, we have parents, we have some grandparents, we have an occasional dad, whatever adults who come with the children. But we've often found that the liaisons are providing encouragement to the parents as well. And I remember, like, when I first had children, my children are now 20 and 18 years old, but I was a supportive parent. I had extended family and good home life. And I remember I was overwhelmed and oh my gosh, am I doing the right thing? Am I being a good mother? And I find that a lot of parents, they just need that encouragement. And so when we're able to send resources home with them, and we have children who come to this program who don't have books at home. They don't have children's books at home. So we get donations of books, we send them home so that these kids are reading at home. We found out that the kids, they like to have bookmarks. I'm not quite sure why you need a bookmark for a children's book, but I guess they've seen it elsewhere. So we have volunteers come in and they'll decorate bookmarks and put little messages on, and the kids take them home and they put their bookmark in their book, and they're so excited about that. We've also we partner with local library systems to make sure that families are going, and we'll go there for a program, get them a library card, and really encourage them to keep doing that. But, you know, if the family is struggling, as I said, to make ends meet, and they need food, or they need whatever other support, we're just trying to make sure that these parents have the resources and encouragement to know that they're doing a good job, so that they are providing supportive homes for their children, which is just better for all of us, to make sure that these kids have a chance to make it. So, let's see, let me see if I can, what glasses go. See if I can find. Here we go. Not sure what that is, but we'll.
Just close. Go back. Go all the way to videos.
Yeah, oh well. It's not coming up for whatever reason. It's okay. As I said, they're on our website, maybe it's just the bad connection, but I did bring some information. I talked a lot about the Alice population. Our United Way has taken the most recent information and broken it down within each of our 3 counties that we serve in, and from there within each municipality. And as I said, there's often great discrepancy even within each county, and then just where you are in that county, it just, you know, it drives the number of people who are struggling. I've also brought a flyer, and it has just a brief synopsis of each of our 4 pillars and a little bit about what they are and what they're doing. She's the one on the front, cute little girl there. It's my coworker's granddaughter. She's just adorable, and we were able to help her as well. So anyway, that's, I know I've thrown a lot of information at you, but our United Way is, as I think you can tell, is doing just trying to do a lot of good in our community, and I know that there are several members here in this church who support our United Way and are involved, and we certainly appreciate that. Were there other questions? Maybe I can take questions.
Any other questions?
Did you bring printed information on the 211?
I don't have a flyer on that per se, but if you go to their website or just literally call 211
Okay.
and talk to somebody live.
Is the United Way of Pennsylvania still supporting 211 financially?
They supported it for our state, yes.
For the state?
Yeah,
Yes.
yeah. United
that's
Way
an important
Pennsylvania.
Part of the mission of United Way as well, because that is growing in stature in terms of the knowledge that people have about 211 being available. And always thought that was
Yes.
a very important initiative.
Absolutely, and as I was saying earlier, there are so many resources in our community, and they often, I shouldn't say often, but sometimes they are not fully utilized because people simply don't know where to go for them or that they exist. So,
How are people referred to you?
good question. Yes, so as I said, our focus is on this Alice population, generally low-income individuals or families. So it varies a little bit by initiative. So, for instance, the school readiness initiative that I mentioned that we partner with the different school districts. We've had a lot of discussion about this at our United Way, and school districts are required to collect demographic information about all of their residents and their students. So we trust their judgment to refer students to us, to refer families to this program who would be eligible for it. We, as I said, we had a discussion, but we decided not to make families complete another form proving yet again that they're eligible when they've already proven it to the school. And I should say this, the school they have laws surrounding that information, sort of like the HIPAA laws. There's a version of that for school districts. So the schools can't share the actual demographics with us, but they can share with us which students and families are eligible and in need of that program. And in some school districts, like Harrisburg, And there are statistics that are available to us through state resources. So in Harrisburg, 97% of the students who attend are eligible for the free school lunch program, which tells us something. In Steelton, I think that statistic is something like 100% when I last checked. So sometimes just by virtue of the school district in the area that we're serving, we know they're eligible. But there are some school districts, so I live in Mechanicsburg. And people might think, well, why would you need a program like that in Mechanicsburg? Well, we have the whole range of economic status in our community, Cumberland Valley, Central Dauphin, some of the other schools. And in fact, I think sometimes it might be even harder for those children because they're starting school with students who have had every resource given to them, and they're not on a level playing field with their peers sometimes. So we're trying to level that playing field and to serve those students in those school districts who most need it. So like in those cases, again, we work with the schools and we might focus our program at an elementary school in part of the district where we know there's a greater need, and that's where they'll meet on site at that school. So that's for school readiness. For basic needs and for healthcare and for workforce development, as I said, we partner with multiple community agencies, and so we're really trusting our partner agencies and the work that they do because they are vetting the people who come to them for services. So we really work closely with them, and again, instead of making people prove the second time that they're eligible, we allow our partners to help us in that decision and just serve who's needed.
Anybody else? Thank you.
All right.